is it?
Yes.
So we are celebrating today 20 years of ICF, but something strange had happened in May 2001. As two devices were launched on the global market, and both have changed the history, although each of them in different areas. The first one was the iPod. It was launched in May 2001, together with the other one, which is ICF. Both of them have been this year celebrating their anniversary. And in a sense, what the iPod Apple team was saying about iPod, I could also use for the ICF. It's a device first introduced in 2001, and has since come out in different updates and types, such as ICF CY, ICF 2017, 18, 20, as well with many related tools, ICF checklist, ICF core set, who does, model disability form. Until now, more than 20 years, ICF has been translated in more than 65 languages, created an enormous value on the functioning and disability areas at the global level. And today and tomorrow, the ICF educating meeting speakers will take you back to the first ICF, to the next ICF. What will be there to see? It's what we're going to have. And funny enough, I would say this was what the iPod people were saying about iPod. However, despite the iPod has been knowing in the last 20 years, a lot of versions, at the end, it was only used to listen music. And that was the only aim of this iPod. While in a sense, this biopsychosocial model of ICF has been very much used for many more things. So despite they were born together, the ICF has been knowing a history of broadened uses based on its biopsychosocial model, which defines functioning disability as the interaction between a health condition and environmental factors. And this has been really revolutionizing the world of functioning and disability. And as we all know, despite all the different classification, ICD-9, ICD-10, and ICD-11 changed, the ICF so far is the only instrument that WHO has been developing to measure functioning and to classify functioning and disability. And it has been sort of paired by other instruments. And last year, we say bye-bye to the ICF-CY, which was developed in 2007 to complement with codes the areas of children. And after 13 years of services and before entering adulthood, the ICF-CY disappeared. So that was a good instrument, which was now embedded in the ICF 2020 version. That is the one that WHO is trying to update, and that was released October 2020 last year. And together with ICD and ICHE, they are part of the family of classification. And in doing the uses of the ICF, we have also to go back to the history of what was planned for its use. The first paper on ICF possible uses, beside what it is written in the introduction of ICF, came out in 2003. It's a paper from Houston, Chatterjee, and Bickenbach, and it was presenting this new tool for understanding disability and health. So that was, in a sense, the first message. We need to understand. And this paper was immediately after the WHO release in May 2001. And it was sort of defining that what was listed in the ICF were all the possible uses. Already 3 years after ICF publication, there was a first review of what was ICF for. It was a review of Bruyère and colleagues, and then they found a wide variety of applications already published and concluded that the results were encouraging. But as I say, 3 years after ICF, it was not clear. But most of the papers in the first year were trying to understand the meaning of ICF. So they were about what it is this new instrument telling us. So the first uses of ICF were, in a sense, culture, were not related to immediate application. 10 years after its publication, two major reviews came out that were trying to analyze all its possible uses. One was from Chernuskaite and colleagues from my group, and the other was from the colleagues from Gelmas and the other. And they both concluded that studies applying ICF concept to health, this was clear, the first areas of application, or discipline-specific management of patients were, in fact, mostly sort of published studies of the use of ICF in the first 10 years, as well as together with the development of core sets, ICF-related items, and other health conditions. However, in the first 10 years, non-clinical applications were emerging, and they were including education, labor, policy, technology development, and also statistics. However, both authors overall were defining that after 10 years, we were in presence of a cultural change because of the growing spread of journals and topics covered. Still, in the first 10 years, there was not so much use in statistics. That is why Nenad Konstajek from the WHO was making a push with one paper in which he was outlining that there was a big value of ICF for disability statistics and health information systems. And this was also a push related to the use of ICD. And he was also saying that highlighting application like multi-country survey, national survey, and national data system were to be seen as possible areas of application of the ICF. At that time, we still didn't have ICD-11, which was in preparation. And it was clear that ICD-11 was going towards a direction in 2011, towards the direction of informatization. So it was very weak still, the application in statistics. What happened in those years was also that in 2006, the UN Convention for the Right of People with Disability was published and ratified by the UN, and that was also pushing very much the use of ICF, because the UN Convention was the frame for policy development for all policies and for all stakeholders. But ICF has been considered since the publication of the UN Convention as the instrument to evaluate the implementation of the convention, which is now in 2021 ratified in 175 countries. Many of them want to use ICF either to monitor the implementation, to support changes in disability statistics or disability eligibility, or in clinical. However, how to use it for many countries is still not so clear in terms of operationalization. What happened in 2013 was that it was published the practical manual, and that was the first detailed instrument that was showing how ICF is and can be used. Mainly, the ICF practical manual was reiterating what was published in 2001, but with much more detailed intervention and areas for the ICF use. Clinical practice, in which it was clear that ICF is very useful for health and functioning, setting goals, evaluating treatment outcomes, communicating with colleagues, and also complementary to ICD, helping to give a full picture of health. ICF should be used, and there were a lot of use cases, to support services and income support, particularly the eligibility assessment, which is now, I'm going to speak in a minute, for population statistics, and particularly it was referring to a paper published in 2007 by Ross Madden on building ICF as building block for statistical information. In education, and there's been a lot of experiences. I want to mention here the experience of Italy, that has been making a full national reform based on the ICF classification, as well as for many policies and programs in which, out of them, advocacy and empowerment was very important, because at that point it was clear that many NGOs or people with disability around the world were, in a sense, despite contesting a bit the ICF, because still considered in a sense medical model, using ICF for creating this common language between politicians and lay people, clinicians, and people in different areas and settings. 15 years after its publication, the ICF was also revised by an intensive review done by Madden and Bundy, in which they were saying that the ICF has made a difference to functioning and disability measurement and statistics. And what they were showing is that ICF stimulates common language and stimulates new thinking, but the field needs to mature. What was clear is, in fact, that in many areas of statistics, particularly, it was not clear by member states and by governments how to use really statistics, and how in statistics the functioning elements should be embedded into the national way. In 18 years after the publication, a very important tool came out, the ICF e-learning tool, which in a sense had to implement the use, and this was placed in the ICF education.com, which is the site where you have all the education material, but this one was requested by the WHO and is now translated in several languages, and it was developed by one of the two, I would say that the beginning of the work, three major collaborating centers, is the Italian, the German, and the Australian, were those who were pushing a lot the implementation of ICF. Then others were coming, but the three major works that you can see in the literature, but not only, even in the WHO report, were starting from these three countries, the German center, the Italian center, and the Australian center. Then all of them were joining, and in the last years, a lot has been done. After 20 years, last year it was felt that there was the need to understand where and how ICF is used. This is why a global ICF use case questionnaire has been prepared by the FDRG, the WHO group that is in charge of the ICF, and was circulated. And there was a request to the 45 collaborating centers of WHO to report which are the main users in their country. What came out is that several countries has been formally reported at governmental level, and the questions about the use of ICF were several, and it was clear that many countries have embedded ICF into the legislation, so they have the word ICF in many legislation. However, in terms of practical application at national level, the use is less done, while the field of research and other fields are really active. So if we change the use of ICF from a top-down approach to a bottom-up approach, we will see that there are not formally collected from entities, several entities that use ICF for several scopes. Other WHO units, rehabilitation, health statistics, emergencies, development goal, and universal health coverage, by other international organizations, the International Labour Office and the UNICEF, by countries who do not have the collaborating center, by many scientific and lay world societies and associations, Rehabilitation International, the World Physiotherapy and Occupational Therapy, European Federation of Rehabilitation Research, the World Federation of Neurorehabilitation, the ISPRIM. And also many universities have been developing ICF courses, although they are not listed, and they're not all of them into the icfeducation.com, let's say, summary. And also the use of ICF should be implemented, because in the ICD-11, the WHO has placed chapter 5, which is listing functioning codes. So all of this and the result of the survey are going to be in a peer review paper that is going to be published in the next months, where together with the Hai Yu Ling and Olaf Krause Camargo, who were the FDRG chairs, we are collecting contribution from all the FDRG members, and we are going to produce this. The other instrument, and I'm going towards my end of presentation, is the HUDAS. 20 years of HUDAS. HUDAS, in a sense, was born even bit before the ICF, but then grew up in parallel with the ICF, and has many advantages that have been depicted. And in a sense, it's practically a bit more used than the HUDAS, because it is used particularly in the disability eligibility and the disability assessment at country level. So far, in international benchmarking that I've been doing for looking at where the HUDAS, together with the ICF, is used for the disability assessment, it comes out that many more countries than those that are listed as WHO Collaborating Center are using ICF and HUDAS particularly for the disability eligibility assessment, including in Germany, some insurance companies. I would say that the country that in my review comes out as the champion of the use of HUDAS in the disability assessment so far is Taiwan, and also it's followed by France. The others are doing great efforts. However, if I have to say which case study would you recommend, I'm recommending Taiwan, because it is one of the countries that has, although it's a small country with not so many inhabitants, but they use a methodology which is in fact paying back, because they are now formally collecting information and making assessment using the ICF and ICF-derived instruments. So this also is going to be published next year in another peer-reviewed journal, which is going to present all these different cases. However, the ICF is also present in many instruments of the WHO, and many guidelines and many training guidelines, and it is in a sense something that together with the WHO we would like to bring into the WHO Academy, that is now a new academy of the World Health Organization that is providing online courses for the world, and this is why we would like to bring it in. There is one issue that most of the countries are not referring to WHO ICF as the instrument for health. So you find, so we are missing also information because many countries are using ICF under the responsibility of ministries such as the Ministry of Social Affairs, the Ministry of Welfare, the Ministry of Employment, and the Ministry of Education, which are not reporting to the WHO. This is why also it's an issue, because we are missing many very useful information that would allow countries to see each other and really develop this important common language. If we have to mention which are the key global strategies in which ICF is mentioned as a key instrument, one is the Rehabilitation 2030 strategy of the WHO. Other is the WHO Decade of Healthy Aging. Then in the monitoring of the UN Convention, as well as in the work that is now undertaken by several groups to define indicators to identify if universal health coverage is covered, as well as to set which are the indicators that show that the Sustainable Development Goals are reached. And also, it is a wide use of ICF in the COVID and post-COVID case report form. Just to say that in the COVID and post-COVID, a paper that came out from the functioning group, I would say, was highlighting since last year that what was missing in most of the countries was the idea of functioning. And the biopsychosocial perspective was in this paper that I show up there, as intended as one of the perspectives that in case of emergencies would allow not to miss and not to left anybody behind, because all the chronic patients and all those who have chronic conditions have been affected, particularly by the COVID. In the case report form of the WHO, which I think is going then to implement the use of functioning, the section 25 is the section that is collecting elements on the long COVID patients, which present a lot of functioning problems. And we have been able to embed the HUDAS areas into the case report form of WHO, which so far has been used by, has been collected more than 190,000 cases of post-COVID people. So far, in fact, we will have, if we want, a section of functioning of all 190,000 cases. So I would say that I already mentioned this, but when we use ICF to monitor the universal health coverage, which is crucial because we want everybody to have access to care, the framework within the ICF can serve is what defines health in detail. And I would say that the introduction of the environment in this is somehow confusing, but it is also very helpful because sometimes you cannot do things for the health intended as body function and body structure, but you can always go on in changing some barriers into facilitators. So providing information on which facilitators we are able to put in place at national level is a good way to monitor the universal health coverage. So I'm coming to an end. And I have to say that if you see what the Apple is providing as new novelty for the iPod, in fact, they keep remaining with producing a higher technical device, but still to reproduce music in all its possible forms. They're going to launch the iPod Max model that is launching and marking the 20th anniversary of the iPod. But I would say that also ICF is marking its 20th year with something that is called the modernization of the ICF, because this year the WHO has been putting ICF completely online on the platform and interacting with the classification ICD and the classification of health intervention. So the future of ICF and HUDAS, it's in fact being on this new platform that is going to be refined by the WHO with the latest version, which will allow many more users to go on with that. Of course, this work is the result of hundreds of people along these 20 years have been working on that. And all these people are passionate people working on their time, believing that health is a critical thing. And I think that despite we come from so many countries, we have been able to create a common language. And now the work is chaired by the two co-chairs, Thomas Maribo and Andrea Martinuzzi, together with Manu Yanes from Mexico. And they keep preserving this. So chairs can change, and many chairs of this group have been changing along the 20 years, but the language has remained common, and this is what we speak. Thank you.
Thank you, Matilda. You've raced through a huge amount of information in just 20 minutes when you have a little more time if you need it. Can I ask if anyone has any questions for Matilda? And if you have, please either put them in the chat or raise your hand.
I was afraid I was too long, which is usually my usual defect. So for
That was
once, I
very-
was in time. After 20 years, finally I made it. And
Yes, very fast and very furious. Well, I just had one question that came to mind as you were talking, and it was about the remit of the WHO is in health, but disability is spread across many government departments, and how you might suggest that we reach disability responsible areas that are outside of the Ministry of Health.
Thank you for the question, because I think this is one point in which at the end of this 2 days conference, we should come to sort of a proposal or solution, because why WHO is missing so many information from the use of ICF is not only because there is a bottom-up approach or because we don't have collaborating centers in all the countries. It is also that sometimes countries are not dealing with ICF in the health sector, while the World Health Organization is the secretariat of ministries of health. And this is sort of limiting the, so while it is clear that ICD, it is used by Ministry of Health because they make the calculation of natality, morbidity, and mortality, it is not clear who is using ICF. So the targets at formal level, governmental level, for the use of ICF are many more, because functioning is affecting many more ministries in all areas of life of a person. And this is something that I think we could think of, how can we capture this use of functioning, and this maybe other presenters can help with this, because for me, this is a question, given that if we collect the information formally from the WHO, we are unable to escape from the issue that in many countries, in more than 170 countries, in fact, ICF, thanks also to the use of the UN Convention, entered into the language. So many ministries want to use of ICF, but UN Convention usually is not taken care by ministries of health, is taken care by ministries of welfare. So then the entry point, the Trojan horse for the ICF is the UN Convention, but UN Convention is not going to ministries of health and is going to ministries of social affairs or other ministries. So then it is where, or the organization of people with disability or wherever, but then it is where we have a gap that we need to define and to identify how we can overcome.
Thank you, Matilda.